Namaskar, I am Dr. Prasun Sanyal, consultant arthroplasty surgeon. In my previous video, I had discussed about the signs, symptoms of fracture neck of femur and trochanteric fracture. Now in this video, I am going to discuss in detail about their management. The management of the fracture neck of femur is almost invariably surgical, but the management depends upon many factors, most importantly the age of the patient and the activity level of the patient. In fracture neck of femur, technically, we categorize the fractures into two parts. One is displaced and is undisplaced or minimally displaced. So, in the patients with non-displaced fractures neck of femur, irrespective of the age, the patient needs to undergo a fixation, which is the dynamic hip screw with a derotation screw or cannulated hip screw. Now, in the patients with a displaced fracture neck of femur, the management depends entirely upon the age. If the age of the patient is less than 60 years of age, usually we indicate an attempt of fixation and osteosynthesis with a dynamic hip screw, with a derotation screw or cannulated hip screw. Now, if the age of the patient is more than 60 years, then the treatment modality will be guided by the activity level, the comorbidity of the patients, and any neurological issues. Those patients who were extremely active prior to the incidents with minimal or no comorbidities can be adequately treated with total hip replacement, either uncemented or cemented. Those patients who were moderately active with few comorbidities and without any neurological issues, they can be treated with either uncemented or cemented modular bipolar hemiarthroplasty. Now, for which patients the cemented or the uncemented hip is better, this is guided by the surgeon's assessment of the hip bone according to the grades of osteoporosis and the diameter of the canal. Now, why the patients with a neck of femur, they require a surgery? Neck of femur fractures can be only managed by surgical management, because if it is not managed adequately, it can lead to complications like avascular necrosis, non-union, shortening of the limb, and unable to walk. Now, those patients who had been treated with a dynamic hip screw, with derotation screw or cannulated hip screw in their early 40s or 50s, they always pose a risk for delayed union, non-union, or even avascular necrosis, where the blood supply of the femoral head gets disrupted. Regarding the prognosis of the surgery, there is only concern regarding the patients undergoing dynamic hip screw with a derotation screw or cannulated hip screw in their age group of 40, 50s. Because while we are attempting to do osteosynthesis, that means union of the bone, the neck femur fracture, it is inherently notorious for non-union, delayed union, and even avascular necrosis of the head, where the femoral head gets flattened. So these patients can experience pain, even stiffness at their hip joint with each passing year. This requires prompt medical attention, and it is adequately managed with a revision surgery with the removal of implants and conversion to uncemented total hip replacement. The trochanteric fractures are usually treated with a proximal femoral nail, a reconstruction nail, or a dynamic hip screw, depending upon the fracture configuration and fracture stability. And this decision to proceed with the implant is almost universally at the time of surgery under the C-arm image guidance, where we decide which implant to choose. Postoperatively, these patients usually have to keep in a period of protected or non-wet bedding until the fracture unites. After the surgery, the patient needs adequate and monitored physiotherapy and guided ambulation with protected wet bedding for the stipulated time period. With a right decision taken in appropriate time, the patients are able to walk independently within few weeks to 1 or 2 months, depending upon their fracture, age, and pre-surgical mobility. Hip fractures can change your life dramatically. If proper attention is sought at the appropriate time, then it will have minimal or no bearing. But if neglected, it can devastate your life. So choose accordingly. Stay connected for such informational videos. Thank you.